My name's Nola White. I'm the Nurse Unit Manager at the Inala Indigenous Health Centre of Excellence. I've been here 21 years. I started with Dr. Noel in June '95. I was recruited to help him set up a clinic, and we've started with nothing, and today we've got this wonderful building. So in 21 years I think we've achieved a lot, and I think it's why we've been successful, because we've had an Aboriginal doctor and an Aboriginal nurse. And because the community, before Noel advertised for this position, it was, he saw community consultation, whether the community wanted a nurse, a health worker or an admin person to work at the community health, and they opt for a nurse, so here I am today, 21 years later. So I'm a descendant of the Gungaloo people from Round Rockhampton area. Okay. Now, my journey as a nurse has been a wonderful journey, and this has been an extremely wonderful journey with Dr. Heyman. So my career as a nurse started in late 60s. I was a Coles fruit girl in Dalby. So I used to play netball. So we were playing netball one night, and one of my friends said, "Oh, my sister's going to go into nursing." And that's when I said, "Oh, I'm going to be a nurse." So with that, because I only had a grade 8 education, that was a barrier. So I wrote to all the major hospitals in the Brisbane area, and Ipswich Hospital was the only hospital that accepted me, which I'm very grateful for that. So I started my nursing career, a hospital-based nurse at Ipswich in June 67, so I wasn't 17 then, I was just 16, nearly 17. So we lived in, and so I was hospital-based, did general midwifery, went and worked at Winton for a while, because between general and mid, and that was, a bit of a excitement time. And then I did my midwifery, and then I worked as a surgical nurse and then intensive care nurse, and worked in the hospital system until I went to Camberwell in '81, because the children, it was easier for the children without shift work. So I worked at Camberwell Aboriginal Health Service from '81 till about '92, and then I helped set up Kelwyn down the Gold Coast when they relocated. So I was there for about 7 months, and then I worked over at the north side, a relieving nurse there, where I met Dr. Heyman, and then he advertised, and the journey started with him then. It's been a really wonderful journey. I try and encourage more Aboriginal nurses, Aboriginal people to go into nursing, because it is a rewarding career. And I was one of the first members of CATSN, the Congress of Aboriginal and Torres Strait Islander Nurses. Now it's called CATSN. Yeah, so that was while I was working with Dr. Noel. And also I could see the difficulty with me having just hospital-based nursing and a hospital-based nursing certificate. If I wanted to further my nursing career, I would need a university degree. So I went off and did my Bachelor of Nursing post-registration, which gave me points to get a better position in Queensland Health. And that's how it's all happened. And soon I'll be retiring. My granddaughter's 18, so she's just started her Bachelor of Nursing, which is really good. It was her decision, not mine, because she wants to come and work here. And the other granddaughter, who's still at school, wants to do the same thing, so that's wonderful.